Good evening, sir. Good evening, everyone. You're most welcome to the Sentinel issue of our Enoch DigiConnect webinar, which is on the eve of the World Health Day 2022. And I welcome you all for this important session because it's almost 2 years when we started this Enoch DigiConnect webinar series to connect with our fellow colleagues across India and abroad. So this Enoch DigiConnect webinar series platform, basically it has been conceptualized for industrial physicians, public health and occupational physicians to share the best organization practices and learn from each other. So this particular webinar is being held every Saturday at 6:30 p.m. And today we have almost covered more than 99 now. Today is the 100th issue of this webinar. And in addition to that, we are also doing monthly OcuHealth Escapes in which we apprise you of the recent updates on environmental and occupational health, which are local, regional, and global. So Enoch, that is environmental and occupational health, it is an ambitious cross-sectoral endeavor that aims to lay out the roadmap for industrial physicians in India to achieve universal health coverage for the workforce of India. And we aim to do this with your active engagement, thoughts, and suggestions, both about the topics that we are discussing every Saturday and also today. And also we discuss the topics which can be taken up for future webinars also. This Enoch webinar series is intended to serve for the platform of the public discourse in India and to engage a wide community, academics, clinical practitioners, and public on the health issues regarding workplace health. It is a critically important that timely discussion on priority actions to deal with devastating pandemic surge and humanitarian crisis response in India. That was very well taken up by this platform. And thank to all the speakers for last 99 sessions and today's session also, Dr. Rajiv Kumar Jain sir. So COVID-19, it has really taught us a new ways to work, how to connect with our fellow colleagues, how to take care of each other. And today on the eve of this World Health Day, where the theme is our planet, our health, It needs to be focused right now because COVID pandemic, it has taken a lot of toll, and it has created a fear in the mind of people, and people are now more conscious about the preventive health rather than focusing on the curative health. In industries also, the management is now more focused on the preventive health, and our duty is to spread this message across India and across the globe, that if your people are healthy, if your planet is healthy, if it is pollution free, if the planet, the atmosphere, surrounding atmosphere, it is not causing any ill health, not causing any problem to your physical health, mental health, then definitely you'll be more healthy and you'll be contributing more. So in this regard, today's speaker for this theme is our resource person, Senior Vice President of AUSD, Dr. Rajiv Kumar Jain, sir. And it will be my pleasure to introduce again him. He is Senior Consultant Health in Indian Railways, New Delhi, and with more than 40 years of experience in health and hospital administration. And he has been awarded Fellowship of Indian Association of Occupational Health and Association of Environment and Occupation, Delhi. He has published more than 145 scientific papers, and he was the first Secretary and Registrar of Delhi Medical Council and core group member of guidelines on medical preparedness and mass casualty management of the Disaster Management Authority. And he has been guest faculty and resource person for many organizations, including EPICO, that is the Scientific Committee on Epidemiology of the International Commission on Occupational Health. And he is ex-editor of the Journal of Academy of Hospital Administration. So a lot of accolades to his credit. I have just enumerated a few of them. You are more familiar, more knowledgeable about his contribution, and he has been the anchor and the resource person for these last 100 episodes which we had conducted till now, including COVID Epi updates, OcuHealth escapes, and webinars with our learned faculties from different fields of medicine, which has kept all of us connected. And may I now request Dr. Rajiv Kumar Jain sir to start his discourse on our planet, our health, how it is important, and how this topic, theme of World Health Day is relevant for every one of us. Dr. Rajiv Kumar.
Thank you, Dr. Sandeep, for the nice word that you've spoken. I want to again underscore the achievements that you made during the pandemic. From being Secretary of Association of Environment and Occupational Health, Delhi, you first rose to the national scene as the Secretary of the Indian Association of Occupational Health, and recently you've been elected as board member of International Commission on Occupational Health. So you're a true representation of local, national, and global role that you are playing simultaneously, in spite of your busy schedule in looking after occupational safety and health in Indian Oil Corporation, one of the giants in not only in India, in the global Fortune 500 companies. And all roles you're playing to the best, and in an excellent way, you are coordinating with diverse range of players, diverse range of organizations, and you're perfectly fitting each role very flexibly and perfectly. So I congratulate you once again. I wish you all the success in future. So for today, we are sitting on the threshold of World Health Organization's Day, or the World Health Day, as it is called. If you recollect, on 7th April 1948, the World Health Organization was founded in Geneva, in Switzerland, in Europe. And over the last so many years, 7th April has been celebrated world over as a World Health Day. And each year, the World Health Organization, an intergovernmental body of 194 countries, declares a theme for all the countries in the world, 194 countries, to celebrate this World Health Day. And for tomorrow, 7th April 2022, World Health Organization declared the theme as Our Planet, Our Health. And it's so appropriate that in the post-pandemic world, we are now preparing for the larger game of not only looking after our health, but looking after the health of our planet together. And if you look at the painting of a woman in the slide that you have, who constitutes the earth, who constitutes the everything in the environment, because she gives birth, which is like the earth gives birth to plants, animals, and the entire life. And that's how life goes on in diverse forms, including life of bacteria, viruses, fungi, and all kinds of life on the earth and in the planet. Could we have the next slide, please? In the midst of the pandemic, a polluted planet, increasing diseases like cancer, asthma, heart disease, on World Health Day 2022, WHO tomorrow will focus global attention on urgent actions needed to keep humans and the planet healthy and foster a movement to create societies focused on well-being. World Health Organization estimates that more than 13 million deaths around the world each year are due to avoidable environmental causes. This includes the climate crisis, which is the single biggest health threat facing humanity. The climate crisis is also a health crisis. Next slide, please. Here, I would like to share a video with you, which shows the theme in 1 minute for the World Health Day tomorrow. So let's have the video. We have to reimagine our world. We have to live with the planet, and our health and planet's health are interlinked with each other. Going ahead, next slide, please. Our political, social, and commercial decisions are driving the climate and health crisis. Over 90% of people breathe unhealthy air resulting from burning of fossil fuels. A heating world is seeing mosquitoes spread diseases farther and faster than ever before. Extreme weather events, land degradation, water scarcity are displacing people and affecting their health. Pollution and plastics are found at the bottom of our deepest oceans, the highest mountains, and have made their way into our food chain. Systems that produce highly processed, unhealthy foods and beverages are driving a wave of obesity, increasing cancer and heart disease, while generating a third of global greenhouse gas emissions. Next slide. Here again, I would like to share a video with you regarding the whole concept of well-being, how it is to be reimagined, and how it is related to the COVID crisis that we have faced just now. So let's have the video.
It's taken a pandemic to help us realize just how sick our world has become. We've been slaves to materialism, building our personal empires and countries' economies. We convinced ourselves that life was great. We were connected to everyone, and yet no one. We ignored the cost to ourselves, other people, and our planet. When COVID-19 arrived, it forced us to stop. We had time to question our way of life. If we had done things differently, could we have been better prepared? As people lost their jobs, their health, their loved ones. As children learned differently or stopped learning altogether. As those who were already suffering suffered more. We've realized we can't go on as before. How can we say our economies are thriving when the cost to our societies is so high? There is a way out of this, and we all have a part to play. Countries should be measuring their success by the well-being of their people and the environment they live in, not just by deals and trade or profits made on products that are threatening our world and our own survival. We need to stop pursuing the same old self-destructive priorities and create conditions for people to live better lives. Health should be factored into everything, both globally and locally, because we all need healthy environments in which to live, learn, work, and play. Some countries are already getting this right. Bhutan has a gross national happiness index, where indicators such as living standards, community vitality, and psychological well-being drive a more meaningful and sustainable way of life. New Zealand has a well-being budget, which uses human health, safety, and flourishing to assess the success of its policies. The UAE's happiness agenda ensures the government prioritizes happiness across all its policies, while Finland and other Nordic countries have adopted a health in all policies approach, growing the well-being of their people. Other countries are also finding new ways to move forward. But more of us need to come together and hold each other accountable for taking the incredible amount of information we have to promote better living and turning it into real action to transform our lives. COVID-19 has cost the world dearly, but it's also given us a chance to change the path that we're on and create the future we want.
For equity, well-being, and sustainable development, we have to rethink and reimagine our world. As you know, air pollution kills 13 people every minute due to lung cancer, heart disease, and strokes. So we need to stop burning fossil fuels like oil, coal, and natural gas. Next slide. 9 out of 10 people breathe polluted air. For this again, to stop this, we have to stop burning fossil fuels like oil, coal, and natural gas. Next slide, please. Burning fossil fuels like oil, coal, and natural gas causes air pollution. So we have to keep fossil fuels in the ground for a healthy planet and a healthy me. Next slide. Climate change is a threat to human health, driving diseases like cancer, asthma, heart disease, and mosquito-borne diseases like dengue. Next slide. 3.6 billion people lack safe toilets globally. Untreated human waste degrades ecosystems and human health. Next slide. 2 billion people lack safe drinking water globally. Protect water sources by preventing sewage, waste, and chemicals from entering our lakes, rivers, and groundwater. Next slide. 829,000 people die from diarrheal disease every year caused by polluted water and poor sanitation. Manage medical waste safely. Needle stick injuries from discarded syringes can cause hepatitis B, hepatitis C, and infectious diseases. Emissions from burning of healthcare can increase cancers. Next slide. Tobacco kills more than 8 million people every year and is highly addictive. It is a major risk factor for cancer, heart, lung diseases, and 600 million trees are chopped down to make 6 trillion cigarettes every year, decreasing the clean air we breathe. So, no tobacco. Tobacco kills. Growing tobacco harms the planet. Keep your bodies and the environment free from tobacco. Our planet, our health, clean our air, water, and food. Our planet, our health, reimagine our economy, reimagine our society, reimagine our health. Rising temperatures and floods caused by climate change will place an additional 2 billion people at risk of dengue infection. Nitrogen dioxide pollution can aggravate respiratory diseases, particularly asthma. Well-planned public transport systems, including safe walking and cycling, can improve air quality, mitigate climate change, and deliver additional health gains. So, for transport, walk or bike to work at least once a week, or use public transport. For energy conservation, change to a renewable energy provider. Turn off the light when not needed. In the nutrition feed, buy your groceries from local producers and avoid highly processed food. Adopt healthy lifestyles and definitely quit smoking. Now, for this World Health Day, there was a Grammy Award to a drummer and a musician from India. So let's look at the Grammy Award ceremony now.
And the Grammy goes to Stuart Copeland and Ricky Cage.
Well, only one of us is allowed to get to talk. But I mean, how about this? This has got to be a first. I'm a rock drummer in this category. Don't ever let anyone tell you that drums can't love. But this album is really all about Mr. Ricky Kedge, who brought these elements together. This award is for Ricky Kedge. Ladies and gentlemen, let's say a word. Don't you dare.
Namaste, everyone. And first of all, first and foremost, I'd like to thank the living legend over here, Stuart Copeland. Thank you so much for joining me on this beautiful musical journey. I mean, I grew up with his music, grew up with his posters on my wall, and today I've won a Grammy along with him. It's absolutely amazing. And thank you to Lonnie Park, Vanil Vegas, Nishant, Diana, and Ponderosa Music and Lahari Music. I just wanted to say something about coexistence, especially during these times. In India, we've got a saying called as Vasudhaiva Kutumbakam, which literally means the world is one family. And when we think about the world is one family, the only thing that comes to our mind is living in peace within the human species. But we have to go further than that, and we have to live in peace with all entities on this planet, whether it is the animals, the wildlife, the forests, the elements of nature, that is the water we drink, the air we breathe, the land we walk on. Divine Tides is all about coexistence. Thank you.
So, Divine Tides. Next slide, please. Divine Tides is the album made by Stuart Copeland and Ricky Cage. And this album has relevance to the theme of the World Health Day. Let's look at one video of a song, one composition, which is important for the World Health Day. Let's have that song now, or that composition now, which tells us about the importance of Earth, our planet, how we are interlinked and how our lives are interlinked and how we have to live in peace with our environment and our planet. So divine tides. So we have to live with all lives on the planet as a coexisting lives as God had designed for us. And we have to ensure that we live not at the cost of others, we live with others and respecting the lives of others as well as the planet vitality and sustainability of our planet. At this time, I would like to share with you another grim reality. That is the reality of billions of people still breathe unhealthy air. Next slide, please. Almost the entire global population, 99%, breathes air that exceeds the WHO air quality limits and threatens their health. A record number of over 6,000 cities in 117 countries are now monitoring air quality. But the people living in them are still breathing unhealthy levels of fine particulate matter and nitrogen dioxide, with people in low and middle income countries like India suffering the highest exposures. The findings have prompted the World Health Organization to highlight the importance of curbing fossil fuel use and taking other tangible steps to reduce air pollution levels. Released in the lead up to the World Health Day, which this year celebrates the theme, Our Planet, Our Health. The 2022 update on the World Health Organization's air quality database introduces for the first time ground measurements of annual mean concentrations of nitrogen dioxide, NO2, a common urban pollutant and precursor of particulate matter and ozone. It also includes measurements of particulate matter with diameters equal or smaller than 10 micrometer, that is PM10, or 2.5 micrometer, that is PM2.5. Both groups of pollutants originate mainly from human activities related to fossil fuel combustion. The new air quality database is the most extensive yet in its coverage of air pollution exposure on the ground. Some 2,000 more cities and human settlements are now recording ground monitoring data for particular particulate matter, PM10 and or PM2.5 than the last update. This marks an almost six-fold rise in reporting since the database was launched in 2011. Next slide, please. Meanwhile, the evidence base for the damage air pollution does to the human body has been growing rapidly and points to significant harm caused even by low levels of many air pollutants. Particulate matter, especially PM2.5, is capable of penetrating deep into the lungs and entering the bloodstream, causing cardiovascular, cerebrovascular, that is stroke, and respiratory impacts. There is emerging evidence that particulate matter impacts other organs and causes other diseases as well. Nitrogen dioxide is associated with respiratory diseases, particularly asthma, leading to respiratory symptoms such as coughing, wheezing, or difficulty in breathing, hospital admissions, and visits to the emergency rooms. WHO last year revised its air quality guidelines, making them more stringent in an effort to help countries better evaluate the healthiness of their own air. Current energy concerns highlight the importance of speeding up the transition to cleaner, healthier energy systems, said Dr. Tedros Adhanom Ghebreyesus, the WHO Director General. High fossil fuel prices, energy security, and the urgency of addressing the twin health challenges of air pollution and climate change underscored the pressing need to move faster towards a world that is much less dependent on fossil fuels. Next slide. The steps governments can take to improve air quality and health are many. A number of governments are taking steps to improve air quality, but World Health Organization is calling for a rapid intensification of actions to do a lot more, like adopt or revise and implement national air quality standards according to the latest WHO air quality guidelines. Also, monitor air quality and identify sources of air pollution. In addition, support the transition to accept exclusive use of clean household energy for cooking, heating, and lighting. Build safe and affordable public transport systems and pedestrian and cycle-friendly networks. Also, implement stricter vehicle emissions and efficiency standards and enforce mandatory inspection and maintenance for vehicles. By doing what? By investing in energy-efficient housing and power generation, improve industry and municipal waste management, reduce agricultural waste incineration, forest fires, and certain agroforestry activities, for example, charcoal production. Include air pollution in curricula for health professionals and providing tools for the health sector to engage. Next slide, please. Higher income countries are seeing lower particulate pollution, but most cities have trouble with nitrogen dioxide. In the 117 countries monitoring air quality, the air in 17% of cities in high income countries fall below the WHO's air quality guidelines for PM2.5 or PM10. In low and middle income countries, air quality is less than 1% of the cities complies with WHO recommended thresholds. Globally, low and middle income countries still experience greater exposure to unhealthy levels of PM compared to the global average. But nitrogen dioxide patterns are different, showing less difference between the high and low and middle income countries. About 4,000 cities or human settlements in 74 countries collect nitrogen dioxide data at ground level. Aggregated, their measurements show that only 23% of people in these places breathe annual average concentration nitrogen dioxide that meets levels in the recently updated version of the WHO's air quality guidelines. After surviving a pandemic, it is unacceptable to still have 7 million preventable deaths and countless preventable lost years of good health due to air pollution. That's what we are saying when we look at the mountain of air pollution data, evidence, and solutions available. Yet, too many investments are still being sunk into a polluted environment rather than in clean, healthy air, said Dr. Maria Naira, WHO Director, Department of Environment, Climate Change, and Health. Improvement in monitoring is needed by people living in lower and middle income countries are the most exposed to air pollution. They are also the least covered in terms of air quality measurement, but the situation is improving. Europe and to some extent, North America remain the regions with the most comprehensive data on air quality. But in many low and middle income countries, including India, while PM 2.5 measurements are still not available, they have seen large improvements for measurements between the last database update in 2018 and this one, with an additional 1,500 human settlements in these countries monitoring the air quality. Here is a slide which shows PM10, and the next slide would be nitrogen dioxide, which are annual means in selected cities by region, for which data were available in the latest year between 2017 and 2019. Look at the peak in 2 cities in the Southeast Asia region in purple. They are Delhi and Dhaka, the highest, reaching almost 200 PM10. So if you look at all the regions and all the countries, all the cities, if you look at African region, Eastern Mediterranean region, European region, the Western Pacific region, and all the regions in the world, stand out 2 cities are Delhi and Dhaka. Even Bangkok and Yangon are very low. But in the African region, again, there are 2 cities like Dakar and Antananarivo. So we have all the regions, but region of concern is Southeast Asia region and Delhi and Dhaka. Next slide, please. We are showing nitrogen dioxide. Here you are seeing the situation is not that grim. In Mexico City is the highest, and in the Eastern Mediterranean region, Baghdad is the highest, while also Istanbul and Dubai are very high. Fortunately, Bangkok, Dhaka, and Lucknow are reasonably lower compared to other high regions, but still high. So you find nitrogen dioxide situation is diverse, as we said earlier. Next slide, please. What can you do to protect our planet and our health? So this should be the focus for a healthier tomorrow, for ensuring that we reimagine our world. First and foremost is what governments can do. Governments can prioritize long-term human well-being and ecological stability in all decision-making. Governments can also prioritize well-being in all businesses, organizations, social and ecological goals. Governments keep fossil fuels in the ground, stop new fossil fuel exploration projects, and implement policies on clean energy production and use. Governments should stop fossil fuel subsidies. The government should reinvest fossil fuel subsidies in public health. Government should tax the polluters. Government should incentivize carbon reduction. Government should implement the WHO air quality guidelines. Government should also electrify healthcare facilities with renewable energies, and government should reduce air pollution levels to reduce the burden of disease from stroke, heart disease, lung cancer, and both chronic and acute respiratory diseases, including asthma. Government should tax highly processed foods and beverages high in salt, sugars, and unhealthy fats. Government should implement policies to reduce food wastage. Government should repurpose agriculture subsidies towards sustainable and healthy food production. Government should build cities with green spaces that promote physical activity and mental health. Government should take the pledge, adopt WHO's Green Manifesto. Tobacco pollutes the planet and our lungs. So government should create smoke-free cities and tax tobacco. Government should devise policies on waste and plastic reduction. Government should integrate mental health and psychosocial support with climate action and policies to better prepare for and respond to the climate crisis. Government should work together with community leaders that include representatives of refugees and migrants on mitigation and adaptation measures of climate change and support initiatives led by refugee and migrant communities at local level. Now we come to the role that corporations have to play, the industry has to play. Corporations should switch off lights after working hours. Corporations should support teleworking when possible. Corporations should remove highly processed and packaged foods from the workplace. Corporations should reduce the greenhouse gas emissions of their activities. Corporations should protect, promote, and support breastfeeding. Breastfeeding is healthy and sustainable food for babies. Corporations should ensure safe water is accessible for workers. Health workers and health facilities, what they need to do. Health workers and health facilities should support efforts to reduce healthcare waste. Health workers should provide sustainably grown local food and ensure healthy food choices by reducing sodas and highly processed and packaged food in health facilities. Health workers should decarbonize health facilities. Health workers should identify opportunities to save energy. And health workers, previous slide please. Health workers should also ensure safe, clean water at health facilities. Health workers should support purchase of environmentally friendly products that are easily recyclable or reusable. Health workers should advocate for health to be at the center of climate change policies. Next slide, please. What about municipal corporations, mayors, the local government leaders? Mayors should promote energy efficient buildings. Mayors should engage low carbon public transport. Mayors should build new bike lanes and footpaths. Mayors should protect biodiversity and create new parks and gardens. Mayors should switch to renewable energy for municipal corporations. Mayors should ensure low-income households and healthcare facilities have access to clean, affordable energy. Mayors should partner with local business community to support sustainability. And mayors should regulate the marketing of unhealthy foods and beverages in public spaces. Now, what should individuals do? All the citizens should do. Individuals should share their story, our planet, our health. Individuals should raise their voice and demand climate actions to protect their health. Individuals should take action and inspire others. Join the 5-point plan. What are those 5 points? Number 1, walk or pedal to work at least one day a week and choose public transport. Change to a renewable energy provider. Don't heat your rooms over 21.5 degrees centigrade. Turn off the light when not in the room. Third, buy your fresh groceries from local producers and avoid highly processed foods and beverages. Fourth, tobacco is a killer and a polluter. Stop consuming tobacco. And fifth, last but not the least, is buy less plastic and use recyclable grocery bags. Simple actions, doable actions, but contribute a lot towards communicating that you mean business in ensuring our planet, our health. Attention is the rarest and purest form of generosity. I am grateful for all the audience here in the Zoom call and in the YouTube channel of Enoch DigiConnect webinar platform for this generosity of attention. I wish all the listeners and all the people who watch this program a very sustainable World Health Day. Our planet, our health.
Thank you, Dr. Rajiv sir, for giving us this broad perspective of how we should live in our day-to-day life along with others and at not the cost of the others. And for the lovely videos which you have shown, which gives an insight on how people should live with the different species which are available on this Mother Earth, and what all we should do, what all we should not do, what organizations should do and what organizations should not do, how unhealthy food, air pollution, imbalance of lifestyle, they are causing ill health and climate crisis. It is also causing ill health. So our health is dependent upon us, and how we keep our how we keep and sustain the health of our planet. Everything is dependent upon them. And yes, we should do more activity. We should use transport like walking, by using bike or using public transport rather than moving in independent vehicles using fossil fuels, because they are the main source of air pollution. And yes, now even the companies, like I am in oil and gas industry, but we are also shifting now to many of the like energy sources which are not causing pollution, like hydrogen or this solar lights or wind power. So everyone is now shifting and trying to shift their focus from fossil fuel to these sort of uh, energy sources. So this was a very lovely session, and on the eve of this World Health Day, on the theme that we have to take care of our planet and our health. Now, may I request the panelists, if they have any questions or any comments, they can unmute themselves and they can just speak out what is there in their minds.
Hearty congratulations, Dr. Rajiv sir, Delhi branch.
Thank you so much.
Yeah, it was really, you made it great occasion on this centenary year issue, 100th issue. And second thing is that our country is so big that we need to infiltrate this awareness at every aspect, actually, in colleges and schools, so that we can reach to a larger extent. And with a great speed in recovery. So actually in Pune branch also, and it's a BOHS work actually, basically. So we should go and do that. So in Pune branch also, we will be taking initiatives on this, and we'll try to infiltrate all this in the so all sectors particularly. So it is very nice to hear. Thank you very much, sir.
Thank you so much for your time and attention.
Any other panelists? Dr. Tyagaraja sir?
Hello.
You are audible now.
Can you hear me, sir?
Yes, we can
Hello?
hear you.
Hello, can you hear me, sir?
We can hear you.
Sir, thank you, sir. Thank you very much. Thank you. My sincere congratulations, sir, to you. It is in a wonderful planet of Earth. Good.
There is some connectivity issue with
into to their own way, where we will going to land after some time. If you see the Sri Lanka, if you see the Pakistan, if you see the Shanghai, I think we are really worried what will happen in case if there is a no good politician leader rules our country, what will going to happen? Sir, it is a really a wonderful, and I congratulate Delhi team, and I congratulate Dr. Sandeep Sharma ji, and my sincere and heartfelt congratulations to you, sir. You have done a wonderful, and most of the knowledge we have learned because of this webinars. Such a good webinars, nearly 100 webinars with HACU, Healthscapes, and also congratulations to Ashish Jain for his wonderful e-magazine. All contributed in such a way that it's the international standard, and IOH is really great. And to that standard, you have made IOH as one of the best. Delhi has really done for the sake of this one IOH. It has nearly, we all feel very happy, and the broad-minded and far-sighted visionary like Delhi team. It is really visionary, because most of us, when we conduct to the branches. But when Delhi team conducted, it conducted for the throughout the nation. And it is really a great, sir. Thank you very much. And please keep it up, sir. Thank you, thank you, thank you very much.
Thank you, Dr. Tyagra, sir. Dr. Shashi Bhushan. Yes.
Thank you, sir. Nothing to say, sir. It was presentation was so nice, and it was a really new topic for us. So good listening, Dr. Rajiv sir, and always we feel to listen Dr. Rajiv sir, always in hospital as well also. So thank you, sir, for your presentation and making us learned about it. And your thoughts are going to be disseminated all over, branches also, because so many people are there from different branches. So thank you, sir.
Thank you, Dr. Shashi. Dr. Maruti. Actually, there are certain panelists who are a regular visitor to this Inov DigiConnect webinar series platform, and Dr. Tyagra sir was one of them, and Dr. Maruti was another colleague who were regularly present in our these webinars. And
Dr. Damodar Lele also has been very regular. Dr. Lele
is also there, and he is very much there. I would request him to speak out what is there in his. I'll promote him to panelist, sir. Dr. Damodar Lele, sir. If you wish to say something, then it will definitely motivate us to do many more things in future. So actually, this platform, this was envisaged when we were having lockdown, and we were all thinking that the life has come to an end. We have all need to be locked up in our house and cut off from the surroundings, from our fellow colleagues. At that time, this new ways of working, they came into being, and at that time, many platforms were available, but thanks to this virtual platform, Zoom platform, which was very much there to give us an uninterrupted service to coordinate with everyone, to connect with everyone, and to bring learned speakers from different areas of medicine, from different like fields of medicine, specialties, and they taught us a lot of things, that how to take care of even the non-communicable disease, comorbidities, how to take care of them even during the COVID times. How to take care of the diabetes, your heart, your knees, your cancer. If someone is having suffering from cancer, then how the things they should continue moving despite COVID, despite this COVID pandemic, and despite this lockdown. teleconsultation we all started. Then Dr. Rajiv Jain sir, he started this COVID rapid updates, and it was such a lovely session that we learned a lot from this COVID rapid updates. And whenever we used to attend this session, and the next day when we used to go for the management review meetings, so many of the key takeaways from his session, we used to replicate them, and we used to tell them, yes, these are the authentic information which we have. And management also helps, and they relied on our information, because they also have many sources of information. But when our sources are they are authentic, then it gives a lot of it improves our image in front of the management. So this platform, it has given opportunity to we all occupational health physicians, industrial physicians, to be bold, learn how to face your management, how to give them authentic news about the COVID pandemic, learn from the specialists, learn from the epidemiologists, learn from public health specialists. And our e-magazine, as Dr. Tyagaraja sir has told, that monthly e-magazine, it was really creating a lot of continuity in our efforts. And Delhi branch, yes, we are all quite proud of our academic activities. And although we were getting a lot of demotivating comments earlier, that why only 4 or 5 people are there, then we started our this DigiConnect webinar platform, and right now more than 180 videos are over there. And this is a great source of learning for all young industrial physicians. They can any time they can go refer to the topic, refer to the best of the these specialists, and they can just enhance their knowledge from there. So
Dr. Sandeep, Dr. Dulera wants to speak.
Yeah.
Yeah. Thank you, Dr. Rajiv Jain, for a nice basically talk on the environment. And then our planet is our health, basically, so save the planet. So government is doing their bit basically in promoting the hydrogen as a fuel. At the same time, electrical vehicles they are promoting more. So we should also do by doing the carpooling, using the bike, using a public vehicles, and using less of a basically fossil fuel. So that way we can do it. Thanks a lot, sir, for a nice and nice webinar, sir. Thank you very much, sir. And thanks to the Delhi team also. Thank you, sir.
So what I was telling, that despite all these roadblocks, we continued with our efforts. And Dr. Tyagaraja sir was one of the most motivating factor for every one of us. After every session, he used to summarize everything in a very elaborative way, and he was just guiding us what to do, what not to do.
Dr. Maruti also wants to say, he's raised his hands.
Yeah, sir. Yeah, sir. Good evening, all, sir. So it's like, sir, we get repressed with everything, sir. Every week we'll be very busy, and the weekend the talk with the Jain, sir, it's ultimate, sir. Just we can say that tomorrow what all the things we can plan. So now we got everything. So I'll repress for one more time, and I will prepare the PPT and I'll present to the many people. So I no need to refer anywhere, sir. Thank you all for the excellent presentation, Jain, sir. Thank you, sir.
That's the purpose, Dr. Maruti, so that the message gets multiplied. It is diffusion of ideas.
Definitely matters. Thank you so much, sir. Thank you, sir.
Thank you for your time.
So thank you, Dr. Maruti. And again, continuing with my story of this last 100 episodes, yes, we were motivated by all the panelists, all the people who used to join as attendees, and even those who used to refer to our Enoch DigiConnect webinar platform, because when we conduct the session on a live platform, few people are there, But when we see after 1 or 2 days, there are more than 40, 50, 60, I mean, more than 100 people views are there. So yes, I know that they are busy in their own activities, but whenever they get time, they do refer. So it gives a lot of value to our efforts. And yes, Delhi has done a good job. But I should also compliment other branches also. They have also done a good job, especially Jamnagar branch, Pune branch, then Tamil Nadu, then Goa branch, Mumbai branch. They have also conducted a lot of webinars in between. But Delhi has shown a sustainability every week. That was a feather in their cap. And yes, our efforts, they will go a long way. This is not a end to our story. Our story will continue. And environmental and occupational health initiatives story, NOC story will continue. Now it won't be a every Saturday affair, but as and when we get time, as and when we get opportunity, we will definitely come back. And every last Saturday, we will continue with our Occu Health Escapes with Dr. Rajiv Kumar Jain, sir, to learn more about local, regional, and global occupational health things which are going on. And once again, I compliment Delhi branch. I compliment Dr. Rajiv Kumar Jain, sir, and all the faculties, all the panelists, and all the attendees who had been attending these programs, and all the viewers who are regularly visiting our Enoch DigiConnect webinar platform. And we'll continue our efforts. Yes, it has shown a light to our efforts, and this will definitely, we will continue. Although the COVID has slightly, it has reduced, but still, again, we are seeing a surge in cases. Sporadic cases are there in other countries where like infection earlier was not there, but they have been vaccinated. Still the surge is there. So COVID pandemic is still not over. I do not know when we will again get this opportunity to again connect with each other and learn from each other. But definitely at every opportunity we will get, we will connect with every one of you. So thank you very much. And thank you, Dr. Rajiv Kumar Jain, sir. And thanks to all the panelists, all the attendees. We'll connect every Saturday, last Saturday of the month. And in between, whenever we are getting chance, some opportunity, we will definitely connect with you. Thank you very much.
Thank you, sir. Thank you so much.